I want to welcome all of you today. Thank you very much for being here. My name is Greg West. I have been here in the public schools for 32 years. In fact, I retired just this past June. And everyone says it's a good time to get out, but obviously a lot of challenges coming up. And what I'd like to do today is to share with you some information about suicide and depression. And most importantly, and the part that I think makes me appropriate for talking about this is the role of a teacher when it comes to these issues in a school system. So most people begin by saying who they are, but I want to tell you, who I'm not initially. So first of all, make it very, I'm not a doctor, so I don't speak on those kinds of terms. I'm not a psychiatrist. I'm not a social worker. I'm not a therapist of any kind. I'm not a life coach. Not a theorist, not someone who's a lawyer who can talk about the legal issues necessarily, a researcher, a specialist, or an expert on any of this. So I don't come to you as some expert who's here to do some definitive talk about suicide. Rather, I come to you instead as a peer. And that's not me. I just found that picture. I thought that was kind of a cool picture for a teacher. I look more like this ultimately, but they say first impressions stick with people. So just hold on to that right now. But what I am and the way I'd identify myself to you for today, I want you to see me really as a peer. I'm someone you'd go to talk to, maybe you have a problem with a student in class you're concerned about, and after school it's a sit down. So again, this is not something, I'm not here to talk as an authority on something. There are a lot of opinions about things, obviously. I was a health educator for 32 years in a public school. I've taught health education all the way from 4th grade all the way through high school, but most of my time was spent in a high school. So the title of this is about suicide in adolescence. And so if you're dealing with younger kids, some of these things that I talk about may not really apply. Some things certainly will, but adolescents are a different population, obviously. I also have other background as well. Emergency medical technician for years. I worked for 2 years on a private ambulance and then 7 years on a fire department. And the thing that I find really interesting about that is that when people find out you're an EMT, especially young people, one of the first questions they like to ask is, have you ever saved a life? Have you ever saved someone's life? And I'll tell you, in all honesty, as an EMT, I don't know. I don't know if I ever saved someone's life. I've done CPR many, many times, and that never worked. CPR only 1% of the time, as far as bringing somebody back with an AE to 20% ideal situations, but it's more about viability than saving people. But I do know that as a health educator, not as an EMT, but as a health educator, I know I did save some lives. I know that I was a trusted adult to some young people who had things going on that were overwhelming to them. And it speaks volumes to me that is where I value a lot of what happened to me in my career. I was able to help people by being a teacher, more so even than being an EMT. So our goals today are 2 parts. The first part is develop a better sense of suicide and depression. I'm sure every one of you have heard about suicide and depression in multiple ways, in multiple courses, workshops, all kinds of things tell us about it. And one of the things that's hard about depression and suicide, and I'll tell you psychology in general. So I was a psych major before I went into education. And I remember the very first day of general psychology, we were told that the definition of psychology is the science of human behavior. And I love that because I'm very into reason and cause and effect and scientific method. And I thought that was wonderful until you sort of get into psychology and you realize there's not a lot of science. There are so many alternative theories of why people do what they do. There are so many cultural differences and variations in people's lifestyles. It is virtually impossible to create a true science out of this. And even things that you would think are extremely scientific. We're going to talk for a little bit about medications used for depression. And you would think that that information would be really scientific. And remarkably, it's not. There's a lot of questions about how well antidepressants work with people. When you look at the placebo effect compared to what these medications actually do, and a lot of the studies about these medications are funded by the pharmaceutical companies themselves. So psychology, it would be great if it was truly a science, but it's a very soft science. It's very hard to make things really very, very easy to understand that are applicable across the board. So what you're going to find is I may say some things that you've not heard before that other people would say that's not true. This is not a hard science, but there is enough that's common to pretty much everyone's idea of depression and suicide that we can. And the other part of the presentation is to help you feel empowered to talk to young people if you're concerned about them, and to give you some confidence in dealing with young people, to be on the front lines with this, which is you should always be comfortable. We're going to talk about potential legal issues with that. We're going to talk about the concern when dealing with young people and having those relationships with them. You know, the problem of teen suicide, we hear a lot about it. We see a lot of numbers. The National Youth Risk Behavior Survey in 2017 found that 12% and 22% of females reported seriously considering suicide at some point. The actual death from suicide is incredibly small comparatively to that number there. You know, because you're talking with females, almost a quarter of them seriously considering suicide at some point. And as you look at the number of people who actually die, teenagers who die from suicide, the numbers are far, far, far smaller than that, which is fantastic, obviously. And they say that only of attempts are actually successful. So these are very, very confusing numbers. You have this massive number of people who've seriously considered it, a relatively small number, ultimately, people who've actually gone through with it. What the numbers don't show us is the actual number of attempts. Attempts are only going to be registered if the person probably ends up hospitalized. So we don't know how many attempts really do happen. So there might be a lot more attempts than we think there are. We don't know what seriously considered means. For a number of almost 25%, 1/4 of females have serious considered, and yet you look at the number of actual attempts and actual suicides, there's a big difference there. And so what an adolescent may refer to as a seriously considered may not be the same way we would look at that. And none of this, of course, really reflects how many people are depressed. So a lot of the numbers here can throw us one way or another, and people present numbers as they want to. We're not going to worry about the numbers. We're going to look at the fact that we know for a fact that depression is a serious problem for our students. We want to try to intervene before they get to a point of being suicidal. We want to do it as teachers in a way that's appropriate for us. But again, what is appropriate for us? What is appropriate for to be doing? You know, what is our job? Because there are a lot of teachers who might say, my job is not to be counseling people. I am out of my element. I'm not trained for this. I'm not certified for this. What is my liability going to be if I get involved? Things get worse because I got involved. And so there's an absolute reason for people to know that. And I think we all know our peers teaching. And our teachers range in schools. We have people who at one end of the spectrum, I'm here to teach. I'm not here to be your friend. I'm not here to hear about your family life. You know, I'm here to get information across to you, and that is it. And that is that teacher. And then there's a teacher on the opposite end of the spectrum who seems to have very few boundaries with students. And we all probably see ourselves somewhere in between on that spectrum in a place that we consider to be the best place to be. But the fact of the matter is, it's not our job to do this, but when we have compassion for the people that we work with, we're going to want to help intervene when things are problematic. And it's right that we do so. When you do intervene, when you let kids come and talk to you, when you have that relationship with them that is beyond the classroom, you have closer relationships with them. You have happier, healthier students that way. And they also learn better, because a student who's severely depressed, who's not having it addressed, is not going to be able to learn as best they can. So obviously those are some great things we can do. This side, of course, this is something that is not written into your contract. You know, none of you are contracted to sit down with students after school or to meet with students before school to deal with their social issues, their family issues, all the other issues. So it's an added workload for you. And again, I understand, especially if you have no background with this, being afraid you can make things worse potentially, or at least minimally make things make better. And then maybe, what if I'm liable for something? What if I say something that a parent comes back at me after me with, the school committee comes after me? What if I'm questioning the values of a family? How can that come back and hit me? So I understand, you know, there are pros and cons to being someone who will work with kids outside of your curriculum. And there's just a balance there. There's no easy answer to this. As far as what your rights are, what the school's rights are, what parental rights are, things get really blurry when it comes to talking to kids about personal issues. So you're going to see I use a lot of stock, stock photography in my presentation. So as I put this together, I was on this stock photography company, type in information, and it brings up pictures that they might be appropriate. So I wanted to get some good pictures of teachers with kids. So I wrote teachers with students. And this is one of the first pictures that came up, which is nice. But actually, before this one came up, this one came up. And you know, you look at this and immediately you begin to realize that there is, unfortunately, this really negative connotation sometimes, and this fear between a student and a teacher. relationship. And we all know that those kinds of relationships have existed. We all know that there are people who advantage students and vice versa. And so this is one of the things that it becomes a barrier to us getting involved with students on a personal level for fear about boundaries. If any of you have Apple Plus, Apple TV Plus, there's a movie right now on there. It'll be released eventually to general, called Hala, which is a beautiful movie about a young woman struggling. She's a Muslim woman struggling with her family as she's going through high school and values and things like that. And there's a really interesting scene where she's close to a teacher at her school, and one night things get really bad at home, and she leaves her home and ends up showing up at this teacher's house. She knocks on his door at night, and he opens the door, and she's very, very upset. And obviously now a boundary has been crossed. She's at his home, and he feels very uncomfortable, but sees how upset she is and wants to help her out. She ends up coming in to talk, and they talk, and then she says, "I can't go home tonight, can I stay over?" And again, a huge boundary. And this teacher is struggling with what to do. He lives by himself, there's no one else there. He can't let her out in the street, but he doesn't know what to do. He lets her stay there, and she does try to make a pass at him that night. It just escalates and escalates. And again, I think this becomes a fear factor for a lot of teachers in connecting with students in a way that's outside the curriculum. Can this be mistaken from other people's perspective, from the student's perspective, or from my perspective? Can there be confusions? So we're going to talk about those boundaries a little well toward the end as we look at how to connect with students in a way that is going to be as safe and appropriate as possible. But having said that, there's no assurances ever that people will not potentially consider the possibility of people's relationships out the boundaries that are normal. Let's begin then talking about depression for a few minutes. And one of the problems with the word depressed, of course, is people use the word depressed all the time. So we hear people talk about, I got a bad grade in this test, I'm really depressed about that. Or, the pizza wasn't any good, I'm really depressed about that. And it's really a misuse of the word, because the word depression is a clinical word. It's a diagnostic term. And when we use the word depressed to mean sad or to mean upset, we're feelings, and feelings come and go. They're fleeting. Whereas mood is over a period of time, it sticks in a lot longer. And so when we talk about someone's mood being low, mood being depressed, we're talking about something that is overwhelming over a period of time, as opposed to a fleeting concern or feeling. So clinical depression is defined as basically being depressed for 2 or more weeks and interference with normal living. And that would be called clinical depression. Again, that's more of a diagnostic term, rather than using the word depressed to simply mean that someone is being sad. Now, does that mean that someone has to be depressed for 2 weeks to be suicidal? Absolutely not. Someone could be having a great day and something terrible happens, and they could become suicidal almost immediately, depending on how they're going to cope with things. So the way that depression only happens after 2 weeks, and the people's reactions to that are going to be delayed for a period of time. It simply means that clinical depression is going to last for a longer period of time. And as you know, there are 2 kinds of depression. They block it off in 2 major sections. There's clinical unipolar depression, which is what we tend to think of with depression. Then we have what used to be called manic depression, or called now bipolar mood disorder. And that is people who are very, very low for a period of time, and then get very, very high for a period of time. And it might seem like those manic states where they're very, very high would be advantageous. I mean, obviously they feel good about themselves, they have a lot of confidence, things seem to be going really well for them, but manic stages are extremely dangerous. I knew someone who got into a manic phase for a period of time, and during that time spent a lot of money, invested in things, had all these business ideas, and committed himself legally to things he would never have done if he was not feeling that way. So the mania part is not a good thing. It's not like it's a balancing out of good and bad. It's all bad, and people are not necessarily rational while they're manic. But we're not going to talk about mania today. We're going to really look at the unipolar depression, which is much more common and probably more what you're going to see in a school system with young people. Now, there are 2 major causes. Excuse me, I'm coming over some bronchitis, so excuse the cough that happened. There are 2 major causes of depression: idiopathic and situational. And idiopathic means of unknown cause, all right? So there's no actual cause for it. And situational would be we can trace the depression to usually some sort of life event that created a problem, that therefore the response was going to be depression. So with we're saying that we don't really know. Think of like sudden infant death syndrome. So what causes SIDS? We don't know. By definition, we don't know why it dies. We just know the baby is dead. and there's no evidence for anything that would have caused that. So we call it SIDS. So idiopathic depression is when someone is depressed, and we don't really know why that individual is depressed. Now, as we go through today, I'm going to tell you a few stories. These are stories that I've experienced firsthand. They're all true. Obviously changes in names and dates and information so no one could ever be identified. But they're stories that I hope to share to illustrate with you from a teacher's perspective what you might see and how you might react to certain things. So I want to start off with the story of Beth. And Beth was someone who was involved in a club that I ran. And she was a student who was an excellent student. I mean, pretty much straight A student. The school I worked in was in a fairly affluent area, and her family had lots of money. They were very affluent. This is a girl who had a lovely family life, fantastic parents, siblings. They had no want for money. She had just turned 16, so they gave her a brand new car for her birthday. She had a boyfriend that was fantastic. She was beautiful. She was successful in everything she did. And one day in a meeting for this group, mid-group meeting, she suddenly gets up and runs out of the classroom. This is after school. And when she ran out of the classroom, she was crying. And I looked at the student who was sitting next to me. What happened just now? Did she say something to you? Did you say something to her? I have no idea. Absolutely no idea. She was sitting here. Everything was fine. So I walked through the halls. It was a Friday afternoon. Nobody was around. And I found her sitting in the hallway by herself, just absolutely bawling her eyes out. So I sat next to her, and she saw I was there, but I didn't say anything. I just sat with her for a few minutes and then said to her, "What's going on? What happened just now?" And she said, "I'm extremely, extremely depressed." And I said, "How come? What's?" And she said, "I don't know." And I said, "Well, do you not know, or do you not want to tell me? Because those are two different things, whatever." And she said, "I don't know. I don't know why I feel this way, but I feel absolutely depressed and horrible every single day. And I just can't get over it." So we talked for a while. She shared this with anyone. She said no. I asked her if her parents knew, and no, my parents don't know. And I said, "Well, can you talk to your parents about this?" And she was very hesitant to bring it up with her parents. She did not know how to her parents. So I said, "Well, may I call your parents? May I call your parents and tell them that I'm concerned about you, that you're depressed?" And she gave me permission to do that. So I called the mom, and I'd met the mother before, and she was lovely. And I said, "I want to let you know that your daughter's very depressed right now." And as any parent would say, the first question was, "What happened?" And I said, "Well, nothing really happened." She said, "Well, then why is she depressed?" I said, "Well, there's not really a reason for it." And I remember her mom's reaction was, "Oh," and actually not "oh good." You know, it's actually worse that way. It's worse because with idiopathic depression, when you don't know a cause of the depression, it's much harder to fix it. You know, if we know that we broke up with somebody and we're depressed because of that, well, people break up with people and people get over that. We know that. But when it's an uncertain reason, we don't know why someone's feeling that way. And idiopathic depression is a lot more scary in a lot of ways. And you don't get a lot of sympathy with an idiopathic depression. You know, she'd come in to sit with her friends at their lunch table during lunch. And, you know, she'd sit down and she looked sad and she looked upset, maybe like she'd been crying. And her friends would say, "What's the matter?" I'd say, "I don't know. I just feel really down." And they'd say, "Why? You know, how's your boyfriend?" "Oh, he's great." "How are things at home?" "Oh, they're fine." "How are your grades?" "Oh, I got straight A's." And eventually they get to a point of saying, "Well, then shut up," right? I mean, life is great. What do you have to be complaining about? And you understand that because we connect depression all the time with situational events, but they're not. Sometimes they're not that at all. And so there's this lack of sympathy. It would be like if someone said they had lung cancer and you said, "Well, do you smoke?" And they said, "No, I don't smoke." You said, "Lung cancer." No, you don't have to do something to become depressed or get lung cancer. They can just happen sometimes. And they're harder when they just happen like that. One of the most important questions I think to ask when you say to a student, "Why are you upset?" and they say, "I don't know," is to ask that question, "Do you not know, or do you not want to tell me?" And that is said in a way that you respect the fact they're not going to. It's okay. They don't have to tell you why they're crying. They don't have to tell you why they're feeling terrible. It's okay not to tell you, but do they know, or do they not know? And that really separates the idiopathic depression from the situational depression. And it's really important to let them know that if you don't know why you're depressed, but you're depressed, that's a really serious, you know, it's not less serious because there's not a reason. And to not have a reason, I think, is to be frightened by it because you can't connect it to something that makes sense to you. And, you know, when you think about it, when you go to a therapist because you're depressed because maybe a relationship ended, you're going to talk about the relationship. You're going to talk about healing. You're going to talk about moving forward. But you go to a therapist and everything's fine except that you feel depressed. it's a whole different story. And then really the issue is the depression and managing the depression as opposed to fixing. There's nothing to be fixed. It's just idiopathic depression. So it's important to understand that sometimes there are no reasons to start depression for people. They are simply depressed. And some people may call it imbalance. We'll talk more about that one as we move forward. Now, compared to that, and the more common one for most people, of course, is situational depression, which is that something has happened in their life that has caused them to feel depressed, to feel this anxiety. And they go through a bunch of different things that can cause depression. I don't think any of these are surprising, and I don't think the list is going to show you things you probably wouldn't have suspected. But just to go through a little bit and talk about how they would deal with adolescents specifically. Obviously, death and dying issues are a huge issue for anybody. I mean, all of us are going to find depression when someone that we care about passes away. And with teenage, it could be a family member, it could be a peer, it could be a celebrity, it could be a pet. And you think of celebrities, you would think, well, you don't even know these people. But I mean, think about like Kurt Cobain died. Think of some of those people who were huge celebrities. People paid a lot of attention to them. They had a message to them, oftentimes through their music. And then all of a sudden they commit suicide or they die naturally. Death can cause, obviously, depression. We expect that. It's perfectly natural. It's perfectly normal for people to experience depression when someone is lost. Job loss and legal and financial problems. Now, as far as our kids, adolescents, a job loss for them is usually not a big deal, right? Because it's usually just a minimum wage job. They're scooping ice cream or stocking shelves or something. With adults, it's very different. With an adult, it's not simply the financial thing that comes along with job loss. It's also a sense of identity. If you meet someone, the first thing you find out about them is their name. And the second thing you find out is, what do you do, right? And that is your identity. So, I'm a teacher, I'm a doctor, I'm a police officer. That is identity. And so with job loss comes a loss of identity as well. So again, this is more for adults usually than for young people. But when a parent loses their job, the depression they may suffer may obviously influence the teenager as well. Legal problems, and teenagers obviously can end up with legal problems. One of the problems with the legal system is so incredibly slow to progress through. So from the time an accusation takes place until a court trial takes place and a decision is made about somebody's future, it can literally be years in some cases. We had a student one time whose dad got involved in some kind of white collar crime, and he stole money from a company or something. He got caught, charged with it, but it didn't go to court for about a year. And the local newspaper, whenever there was news about the case, would of course put his mugshot on the front of the local paper with what was going on now. And we're all voyeurs on this negative stuff that happens to people. But what I saw was the effect it had on his son at the school, which the sheer embarrassment every day. When you come home, you come to school, and that the day before that the local paper came out, and dad's picture is on the front, and this whole write-up. And this student told me one time he was in line buying his lunch, and some other student looked at him and said, "Is the money you're paying that for that lunch, is that what your dad stole?" Which it's and I get it. The father did something wrong. I get that, but it's falling on the student, who of course became very depressed because of that. And then financial problems, of course, can affect the quality of life, feelings of being in control, and in some cases, of course, can lead to homelessness. I had a student come in one time who was shocked that the day before she got off the bus, walked around the corner to her house, and there was a moving truck there, and she had no idea that her mother had not paid for rent for several months, and they were being evicted. And this happened overnight. And as you know, if a student then goes to live in another district, they're out of your school now. And so there's huge ramifications with financial for a student when they originate with the family. Health problems can cause a lot of depression in people. We see that all the time. Obviously, if someone became very, very ill, we expect depression. We see it as a complicating factor when people have a huge health problem. Imagine something like being on dialysis the rest of your life. If your kidneys are destroyed, and every other day you have to go in and have your blood, you go through hemodialysis every other day. That's a huge change in quality of life. On a more temporary basis, think about some of your students, if you're teaching at a high school, who love sports, who end up with multiple concussions in a season, who are thrown out of their sport. And to them, it is a huge, huge deal. As I'm sure you know, some of your students come to school because of sports, because of activities. That's what draws them. Their passion is not school. Their passion is the other things. What happens when their health gets in the way of being able to be involved in those things? Those can be very, very drastic changes for young people as well. Holidays and anniversaries. If you talk to your school's guidance counselors and ask them, what's the busiest when students come in and are sad or upset or need some assistance, and they're oftentimes just prior to holidays, just prior to school vacations, and prior to the summer vacation. And part of that is because they have to be home all the time, and not everybody's home is the best place to be. And I always think about the Christmas holidays when before the holiday actually even happens, people are coming in wearing their festive sweaters and hats and giving gifts to each other and all of this. But for some students, being at home for that entire week is an absolute nightmare. They have a lot of trouble in their home, and they don't want to be at their house. I've seen students before who book themselves so heavily that they basically arrive at school when the building unlocks in the morning and leave when the building gets locked up. I had a student one time, every club that had morning meetings, preschool meetings, which start at 7 o'clock. The doors usually open at 6, and she would be there at 6:30 to enter the school. And she'd do her meetings, she'd do her regular day, she'd do an activity after school, and try to book herself for after school as well. Sometimes in the evenings, they would have, for example, music concerts or music rehearsals. So she joined band to be able to be there. She wanted the house as much as she possibly could be. And so when a holiday comes, it is not something they look forward to. On the contrary, it is something they dread. And so while everyone else is celebratory and happy, they're feeling just the opposite. During holiday seasons, families get together. And so when a family member has passed away, so say a grandfather passes away, it might have happened last March, but now it's Thanksgiving Day. And, his place at the table, his role in that ceremony that everybody's at has disappeared. Someone has to fill that. And so it's a reminder that someone has passed. And so even though someone may have seemed to have gotten over some depression, they suffered from a loss, it can come back very, very quickly during something like a holiday, an anniversary, or even when somebody else dies. We had a student pass away years ago, and a lot of students went to the funeral that day. And I heard some of the closest friends of that student very angry about some of the students who went, because they said that some of the students who went to that funeral mass, they were not friends with that individual. And yet they seemed to be some of the most emotional people who were there as far as being upset. And what people have to realize is that, when you go to a funeral, when you're dealing with someone else's death, all the deaths you've experienced surface as well. And this catharsis sometimes happens during of someone's life for the ones that you've lost as well. And so these things come up. And then sometimes anniversaries of things as well. There might be an anniversary date when someone passed away that you cared about, or some event took place. Interestingly, I knew of a young woman one time who she became pregnant. She wanted to have an abortion. She had the abortion, and I saw her the day she had the abortion. And I was surprised because she was absolutely fine. I mean, it was just a regular, no matter how you feel about abortion, going through one is emotionally difficult for anybody. And yet this individual seemed perfectly fine, like it was no big deal, just procedure, and off she went for everything else, which was really, I thought it was odd. And then 8 months later, severe depression, because it wasn't until the date the baby would have been born that it actually caught up with her. So it's almost like post-traumatic stress disorder, where trauma takes place and the reaction to that trauma is delayed for a period of time. So sometimes people will suddenly become depressed, and there's nothing going on now necessarily, but in the past that is triggering the depression. This picture was actually drawn by one of my students' brothers, and allowed us to share, where he drew this image of this kind of faceless individual, and they're wrapped up and can't escape from something that's sort of linking them into this picture of a pill at the bottom. And it was his way of kind of showing the darkness and the entrapment that he felt by substance abuse. And ironically, for depression, sometimes people start using substances as a way of coping with depression, and then sometimes it becomes a reason to be depressed afterwards. And addiction, use, and withdrawal are all very, very difficult to go through. We'll talk a little bit more about that as we move on today. Divorce or change, people separating, people getting divorced. There's the physical and financial responsibility of the kids, and older kids sometimes are asked to choose which parent to live with. You know, what a horrific thing for a young person to have to choose. Remarriages and blending of families. It's not always the Brady Bunch. Not everybody always gets along. Not everybody's always happy about this. And then besides all of that, there's just a changing in relationships with parents during this period of time. Being an adolescent means challenging the norm. It means stepping out of what family expectations are and coming up with your own expectations. And all of these things create stresses that can lead to depression. We mentioned a moment ago the possibility of someone being evicted, but there's all kinds of relocation reasons. For, you know, a lot of people in the military end up relocating every 3 years. And for students, that's a very difficult thing. You know, we had a boy one time who loved his parents, loved his family, but he was going into his senior year when his dad had to change locations. And he begged his family to let him stay with another family, with friends, just to be with the people that he'd grown up with for 12 years. And the family actually allowed him to do that. And it wasn't to be with his family, but it's very, very hard for an adolescent to relocate and to change all the relationships they've had for all that time. And we're seeing right now more than ever before, and more than since the 60s, basically, the issue of oppression, discrimination and injustice, people feeling they don't fit in because of who they are, being prejudged, and the feeling of not being empowered. You know, so much of education is about, we educate you to empower you, to get a better job, to have a better life, to do the things that you want to do. And yet if people feel there are forces above and beyond that, no matter how smart they are, they're not going to be able to still make it in this world. That creates incredible frustration. And there's a whole history of that that backs up the fact that they may not be able to do the things they want to do. And that can certainly lead to people feeling depressed. One of the major issues, of course, during adolescence is sexuality. And there are just so many possible issues under sexuality as they begin to understand their sexuality. There's the sexual orientation and gender orientation, pregnancy, STIs if they're sexually active, unhealthy relationships that might form initially, abusive relationships. A big problem today, of course, of revenge porn, where people share intimate pictures with someone that they're close to, the relationship ends, and now those pictures are used as a way of coercing them or blackmailing them or in some way disparaging them, and just general harassment. So along with the difficulty of dealing with sexuality in the first place are now these incredible complications that come in as well. We're not very good about talking about sexuality with kids, especially within families. I taught sexuality as part of the health curriculum, and I'd always start off by saying to students, how many of you have never had a conversation about sex with your parents? And in most cases, it was about 1/3 of the students had never talked about sexuality at all with their parents, which is remarkable to me because parents usually have absolute expectations about what they expect of their kids as far as sexual behavior, yet it never gets literally spoken. Parents are concerned about it. They don't know what to say about things. Sometimes they're embarrassed. On the other hand, there are some parents who talk a lot about it, and some people are extremely strict about it. I had a young woman one time who came out to me that she was a lesbian. I was the first person she ever told, which was, I think, one of the most honoring things I've ever felt. I said to her, have you talked to your parents about this? And she said they would not understand, they would not accept. They're extremely religious, and they would not ever accept this. I said, well, do you think because it's you that maybe you'd break through some of those barriers there? She said, no. She said, I tried one day. There was a news piece on about gay marriage, and I started bringing that up with my mother, and my mother's response was, I'd rather have a dead kid than a gay kid. And she said, and she meant it. My mother meant that, absolutely meant that. So this is not an issue I can talk to my parents about. And this is really, really hard. And I understand that parents don't understand, you know, depending where they grew up and how they grew up in their religious and cultural backgrounds, I get that they don't understand. But the ignorance, there's too much knowledge about sexuality today to bask in the ignorance of the past, to pretend that this is just a choice that someone is making to upset somebody else or whatever their thoughts are, to think that they're recruited by gay people. And there's so much crazy thought out there. I find that really difficult to understand because there's good information that we're open to it, but some people would rather clutch onto their ignorance than to be informed about the realities. And people face a really tough challenge as they try to get through these difficult years in high school where their parents can pretty much see what's going on with them and sometimes suspect. And of course, there's cyberbullying. You know, Pre-cell phone, it was so easy to know where your kids were, who they were talking to, what was going on. If their friends were over and they're having a fight, you'd hear the fight in the other room. But today, with technologies, there can be bullying 24/7. Sexting, of course, is a problem. Spreading rumors is a problem. Harassment, and in the past, there was this telephone thing. If you want to spread rumors about someone, you told one person, maybe they told the next person, and it took some time to spread, and it would sort of, at some point, usually die out. Today, a simple post, and thousands of people can see it instantaneously. So it's very, very hurtful and very, very harmful. And as much as we'd like our kids to be off social media, especially today with what's going on with the pandemic, social media is the only way of being social for a lot of them. But unfortunately, not all the social things are beneficial to them. Lots of romantic relationships and friendships. As an adult, if you were to get romantically involved with someone, there's usually a certain pacing that you bring to your relationship. You don't jump in on the first day and tell them everything about you. You develop trust over a period of time. But adolescents jump into relationships awfully quickly. And what people would love to refer to as puppy love, it's their form of love. It might not be your form of love, what you know love as, but it's what they know love as. And part of being loving to them is to be very, very open. And that means that when a relationship ceases to take place, it's very, very painful. And so even a relationship only lasted 3 weeks, which most of us would look at and say, 3 weeks, how close could you have gotten? To them, it was very close. And it does feel like the world is ending to them. And sadly, as teachers, we contribute to the pressures of young people in an attempt to have them do their very, very best, achieve all that they're able to achieve. We put pressures on them for grades. We put pressure on timing. We tend in most schools not to check with other teachers to see what are going to be due. We give long-term assignments that are at the same time, and there are tests on that day, and there's MCAS that day, and there's all this other foolishness. It's very hard sometimes seeing from their perspective. And I think a lot of adults pass young people off as simply, this is your job, school is your job. And if you can't do your job, then quit the other things that you do. Quit the sports, quit all the other things. And that's just not realistic, nor is it healthy for people. It would be a much better place if we could find a way as teachers to communicate with each other, to understand that we don't put too much pressure at one time on students. And, ironically, students who are the best students, the ones who, and this image is a wonderful image. I mean, here's a person, she looks healthy, she looks happy, she looks studious. And especially the girls, they're the ones we see doing things like cutting. When they talk about the typical student who cuts, it tends to be someone who's high achieving, who when people find out are blown away by that because they seem like they are the most together individual that you've ever seen. But the fact of the matter is they need to release the pressure somehow. And that's one of the ways that they can release the pressure. We'll get to that again as we move on a little bit. I'd like to make a movie recommendation for all of you. I consider myself really good at recommending movies. I've got perfect taste in film. But this is a gentleman named Chris Gethard. And right now, this show, this is several years old now. It is on HBO Max right now, so I assume it's on regular HBO as well. It's an hour-and-a-half long stand-up routine called Career Suicide. And it is very, very funny, and it's very, very poignant. Chris Gethard has mental health issues. He's had them most of his life. And I've never sat through an hour-and-a-half long presentation before that I guess allowed me to empathize as much on a subject that I really couldn't comprehend just on my own or by reading something. He talks about what it's like to have a chronic mental health problem. It is incredibly funny and is amazingly entertaining hour and a half, but it also is tear-jerking. It's just, I think, the best of long-term mental illness as far as communicating it to other people. One of the things he says toward the end, he says, this isn't the kind of thing that gets better. You just have to live with it. And I think with mental health issues like depression, we oftentimes think that with medication and counseling, things will get better. And they don't always get better. Sometimes they are chronic for people. And I'm not suggesting we ever say that to a student who comes and says they're depressed, but to understand that it doesn't always get better, that sometimes it's like an amputation. It doesn't get better. Your life has changed now. And now you need to find a way to live with that chronic condition that will never go away. I think I've watched this thing 5 times. I watched it again last night in preparation for today. It's just absolutely fabulous. And it will give you some empathy into the world of people who suffer with mental health issues that you might not otherwise be able to gain. So I do have a sheet of resources at the end that I think is going to be distributed. So down, you'll get that afterwards. But again, HBO, Chris Gethard, Career Suicide, absolutely fantastic, fantastic video. So what happens when people are depressed? When people are depressed, what goes on to help them with it? Well, obviously counseling, some sort of cognitive therapy. And here again is where we get into real discrepancies on how people care for depressed. About 2 years ago, I went into a hospital in Boston. They had a conference on adolescent sexuality, looking at sexual orientation and gender issues and all these different issues. And it was several days worth of conference, and it was mostly doctors and nurses who were there. I mean, there were many teachers, but I was blown away by the fact that 2 out of 5 presentations on one day took a look at gender and sexuality issues from the psychoanalytic perspective, from the Freudian perspective. And that blows me because Freud was basically, from the 70s on, we've not believed in Freud. I mean, we believe that Freud figured himself out pretty well, but he figured out everybody that way. Just not true. Psychoanalysis is very unusual today, okay? Going to id and ego and superego and all those things, it is a past philosophy that is no, and yet 2 out of 5 in this Boston conference about sexuality, we're looking at it from a psychoanalytic point of view. And I think we have to be careful of that because again, this is where that science of psychology, it's not really science in a lot of ways. There is some science that just don't work. And what has been proven to work really best scientifically is cognitive behavioral therapy. This is much more behaviorism, you know, the B.F. Skinner kind of things. We're looking at reinforcement and looking at stimuli and environment and try to take control of your world that way. It really is empowering to people. Psychoanalysis usually takes about 7 years for people, and it simply, you know, ties up repressed feelings and dreams and all of this. And I guess, you know, some people believe in this stuff, but today it really doesn't hold its own scientifically at all. So, you know, counseling really has to be done in such a way that an appropriate counselor, not anyone who's a therapist is right for everybody and is right for sort of what you bring into a therapeutic situation. But counseling is really, really important. Medication may and may not be. We're going to get to that in the next slide. But I want to talk about hospitalization for a minute because one of the things that's very, very hard to do is get a hospital bed for psych. With psychological problems, there are so few beds and so few adolescent units. I had a student one time who was depressed, who was put into a local hospital. It was a psych unit there. And it was her, now she was a 17-year-old high school student, and everybody else in the group was a 30 to 70-year-old male who was there because of substance abuse. And while she did get one-on-one counseling in this process, she also every day had to sit with a dozen men 3 times her age who talked about their issue with substance abuse. And it was completely inappropriate. You know, unfortunately, we don't have a lot of good places for psychiatric issues for young people. They're oftentimes really bad. But what hospitalization usually is doing is keeping people from committing suicide. So one of the terminology things that they'll talk about with people in depression is they'll ask them, are you feeling safe or are you feeling unsafe? And the definition of safe and unsafe when it comes to this means that I'm going to be able to promise you that I'll be able to make it to our next meeting, our next counseling session without killing myself. And unsafe means I can't make that promise. Now, obviously anybody could just lie if they wanted to, but they're not going to counseling because they want to. They're going to counseling to not kill themselves. And so they're motivated, hopefully, to avoid that. And so at the end of a session, if a therapist was to say, do you feel unsafe? And they say, I feel unsafe, they're hospitalized now. You know, but that's what it takes to get hospitalization sometimes. It has to be unsafe, feeling that you cannot commit to not killing yourself before the next time you meet. And most people are safe or report themselves to be safe. When they say they're unsafe, then things get brought to the next level and will end up usually hospitalized periodically while you separate them from all the things they could use to kill themselves. You know, if you've ever gone into a psych ward before to visit anyone, you'll know that they can't have anything that could be broken and used as a sharp weapon. So no pieces of plastic or things like that. They can't have ties on their shoes, laces. I mean, anything that could potentially be a risk to taken from them. And so a hospitalization, part of it is just alienating them from any tools they could hurt themselves with. And then of course, the other part is trying to get control of their thought process to give them more control so they won't hurt themselves. Well, let's return to medication, because I think medication is important to understand. So we hear that some people, the idiopathic depressions, are caused by a chemical imbalance. And basically what they've tried to do with antidepressant drugs is they look to increase the amount of serotonin and inside the brain, and they're trying to change the neurotransmitter things. And this is not something like an endocrine problem that you could identify with a test. So in other words, if you were diabetic, you could check someone's blood, you could check their sugar levels, you could check insulin levels, and see that there is a chemical imbalance there. That is not how it works with psych medications like this. It's not that you detect an imbalance and then treat the imbalance with meds. Meds that theoretically increase certain chemicals in the brain, and if they get better, well, that was the problem. That's how it worked. So again, it's a much more softer science than that. And there have been studies that have demonstrated that some of these medications that are supposed to increase certain levels in the brain don't necessarily. And there have been studies that demonstrate a very strong placebo effect with these medications. So whether they get a sugar pill or an antidepressant, it works pretty much the same way for some people, not for everyone. There are absolutely people who need antidepressants. But look at the problem with this. Some people will respond to a placebo and they'll get well with that. Other people go on these medications. And once you're on the medication, one of the problems with these meds is most of these psych meds take 4 to 6 weeks to kick in. So you try a medication and 4 to 6 weeks later, if it's not, you try another one. And you keep trying different meds until some benefit is achieved. Now, whether that benefit is achieved by the drug or by time that's gone by is not clear. Now, you don't want to not give medicine to someone who will benefit from it. But if you do give medicine and they're on it, then the question is, well, did the medicine cause the benefit, or did time make the depression go away? And you don't want them coming off of medicine if they're going to go back to being depressed again, because it's going to take 4 to 6 weeks to kick in again. So you have this real problems here on, what to believe about them. One of the pharmaceutical companies, made their medicine works twice as well as a placebo, which is kind of weird that the medicine works twice as well as a sugar pill, which does nothing, but is also obviously at some level effective. So medication is always going to be controversial, and different doctors, different therapists are going to feel differently about putting people on medication and then whether or not to wean them off or not. And another problem with medication is the issue of compliance. Will people take their medications? Well, why wouldn't you take a medication? Well, there are a number of side effects to antidepressants. One is weight gain, and the weight gain isn't severe, it's not huge, and yet for adolescents, especially with smaller bodies, any weight gain seems huge to them, and so that is a problem for some of them. For some of them, it causes insomnia, which, insomnia creates short temper, it creates the inability to concentrate, so that can affect grades, that can affect relationships. For some of them, it causes headaches. And headaches is another thing that, again, affects your ability to concentrate and to socialize with people. If you have a raging headache, you feel horrible. And so, taking the medication might help with the depression, but it also makes my schoolwork not as good. It also makes my relationships more challenging. And so there's this balance going on of quality of life. What's worse, having the depression, successful in other things, or having next. Now, the good news is most of these side effects can be dealt with if a doctor is told about them with another medication potentially. And so it's not as though side effects should stop us from taking medication. We have to look at the bigger picture. Adolescent, you can see that they're not going to easily tolerate side effects. A very interesting one is loss of libido, loss of sexual interest and sexual energy, and in males, sexual dysfunction as far as erections go. In the past several years, I've actually had 4 students come up to tell me that they were asexual. And the first person to ever say it was a girl who, the reason she told me this was she felt that as we started talking about sexuality, we work in this assumption that everybody has a sexual drive, because that is certainly the norm. But she wanted to be sure that it was represented that there are people who simply don't have a sexual drive. They just don't. And it was a fair criticism. I appreciated that. But the other people who told me that they were asexual also talked about having boyfriends or girlfriends. that they really cared about, and they were frustrated they could not be more intimate with them, physical with them in any way that gave them any pleasure whatsoever. And in 2 of those cases, I said to them, are you on an antidepressant drug? And in both cases, they said yes. And what this means is that when young people are antidepressants, especially if they're like pre-sexual, if they're 13 or maybe 14 years old, they're not really feeling sexual yet, they may have never felt sexual at all. And they're very, very different from everybody else because they're not having feelings that everybody else seems to have. And I think the problem as far as physicians may be talking to students about this is if you're talking to a 13 or 14-year-old, you may not be talking about decreased libido. That wouldn't make sense maybe at that age. But as they grow into this part of their life and they're still on these meds and they're noticing something that's different about them, these are important things they need to understand about medications. And once again, this is not to say they should come off the medicines. That might be the worst thing in the world for them to do. On the other hand, physicians need to be aware that they're having these or not having these feelings and deal with them. For males, erectile dysfunction is very uncommon in young males, extremely uncommon, but with certain drugs, it can become an issue for them. And so once again, you know, if physicians aren't talking about this, and I get the fact that some of these doctors are pediatricians, they don't deal with kids often. And so dealing with sexual issues or even acknowledging they're sexual might be hard for some of the older doctors. But it's important that the young people understand this. But it's another reason why they might want to get off their meds. Why am I going to take this medication if I can't enjoy my boyfriend or girlfriend like I used to? Basically, of depression for us. Let's take a look now at the issue of suicide. And I'd like to start off by the definition of suicide. I want to look at this globally for a few minutes. Not that it necessarily, is fully apparent that this is going to affect with adolescents, but to understand suicide in its entirety. So it's called the act or instance of own life voluntarily and intentionally. So that's the definition of suicide. But what you hear people say all the time is suicide is a permanent solution to a short-term problem, or suicide is the coward's way out. Both are extremely negative ways of looking at suicide. And I know you're probably thinking, well, of course you're going to look at suicide negatively. It is a negative thing. We don't want people to commit suicide. So these are great things to say. And again, I think I want to look a little more globally for a minute. For example, there are suicide bombers, and not promoting, but saying they're sacrificing their life for a cause. It's suicide. It's not because of what we just said. It's not because it's a coward's way out. It's not a permanent problem, okay? We look at military and civilian heroes. We've heard about, the soldier that throws himself on top of a hand grenade to save other people. Again, it is suicide, but it's not seen in the same way. And then there's suicide because of long-term issues. One of the people who's always looked at as a total influencer on death and dying is Maury Schwartz. Now, if you've never heard of the book Tuesdays with Maury, it's a fabulous read. In 1995, Maury Schwartz died of ALS. He suffered with it for a period of time. And the story is written by the gentleman who's sitting next to him there. Mitch was a sports writer and Maury was a college professor here in Massachusetts. And Mitch had him as a teacher. And they were very, very close. They had a really close relationship. And after he graduated, Mitch promised to always be in touch with Maury in the future. And he never was. He never got back to him again. And then one night on television, he sees him featured on Nightline, 11:30 TV show on Channel 5 now after the news. And he saw him featured because Maury was dying, knew about his death, and was talking openly about the process of dying. And people just don't do that. And he felt really guilty about it. So he actually contacted him, went to visit him, assuming he was just going to visit him once, but decided to keep on visiting. And then because Maury had really high medical bills, he said to him, look, I'm a writer, I'm a sports writer, but what if we take some of your ideas on life and death and put them in? It turns into one of the best-selling books of all times. It's also been a movie. It's also been a play. So it's a very, 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 very common book. You may have seen it. What's interesting, and I used this book in a course I taught. I got hold of the DVD of the actual interviews with Maury. They did 3 of them on Nightline at 3 different stages of his dying with ALS. And in one scene, Maury is talking with Ted Koppel, and the cameras are thought to be off at this point. And they're rearranging lights and things like that, and they're talking. And Maury reaches over and says to Mitch, I want to tell you a secret. I've had my doctor promise me that when the end comes, he'll give me the lethal dose. And they later got permission to air that. They never aired it, although it's on the DVD. But here's this gentleman who was always looked at as being something of the most accepting person who accepted death as it comes naturally to him. And it's not true. Maury very much wanted to be in control. And in the end, he wanted to control his own death. He wanted to have his doctor give him a lethal injection if suffering got to the point he no longer wanted to go through it. I just think it's an important thing that we look at suicide globally. It's not this coward's way out. You know, this man was not a coward at all. And then there are people whose lifestyle changes, right? The Craigslist killer, Philip Markoff in Boston, Jeffrey Epstein, kill themselves because lifestyle changes are not acceptable to them. So people change for a lot of different reasons. Suicide is much more complex. But regarding that sense that, you know, the permanent solution to a short-term problem, it is a solution. For someone who's suffering a horrible issue, it does make it go away. But when you use the word solution in a definition, to the adolescent, it might be saying, even though you might think you're saying it negatively, it might be seeming that it's actually something to consider. You're calling it a solution. It is a solution, but maybe we shouldn't be using that word because we don't want people to hear that word and make an assumption that is it's one that should be entertaining as opposed to one that we should be rejecting. I had a student one time who I did not know very well at all, and saw her outside in the hall, kind of teary one day. And I said, "What's going on? Are you okay?" And she said, "No." And I said, what's happening? And she just like let loose. Every once in a while, you're the right person at the right time at the right place. Even though I barely knew her, she was very, very open. Her basic story was that she was very, very depressed and suicidal because she had been sexually abused when she was in elementary school by her brother's best friend. That had gone on for a period of years, as I understand it. And it was a long time ago. I mean, she was a high school junior at this point, and it was coming back and really haunting her now. And it turns out the reason it was really haunting her was she was really scared of dating, really scared of boys. And yet she was an attractive young woman. Prom time was coming up and people were interested in prom, and she really wanted to go to prom, but she was also scared. And this is just bringing back all the things that had happened in the past. So we had a long conversation, and I got her to talk to a counselor and get her involved with the counselor at the school, and therapy started and all of that. Now, you probably can understand that when people are back in time and they need to come to grips with something that happened in their past, it gets worse before it gets better. You know, as you begin to have to explore that with a therapist, you don't get well by sharing. It gets worse for a period of time. Then you work your way through it to the point that things can get better. But things got really bad for her for a while. And this is a long time ago. This is pre-cell phone. And I just remember one night, it was about 2 o'clock in the morning, and my phone rang. And it was this girl. And she said, "This is Beth." And I said, "What's going on?" And she said, "I'm calling to say goodbye." I said, "What do you mean say goodbye?" And she said, "No, this is too much. I can't go through this anymore. I want to kill myself." And she said, "You know, and I said, "How are you going to do it?" And she said, "The pills here, and I have a razor blade." So we talked for about an hour and a half. And after a while, she calmed way, way down, and things were much, much better. And then I said, as she was ready to go to sleep now, she was exhausted. It was 3:30 in the morning. And she said, "Thank you for helping me. I want to go to bed now." And I said, "You need to put your parents on the phone." And I did not go over the way she wanted to go. She did not like that idea at all. She said, "I'm not letting you talk to my parents." I said, "You need to." And she said, "You said what I would tell you is confidential." Now, we're going to get to this in a minute, but when you start talking to young people, you need to define what confidentiality is, where the boundaries are. And it was very clear. And I told her, "If you're ever suicidal, I'm going to..." And I did not know her parents, never met the people. And she was furious. And she said, "I'm just going to hang the phone up." I said, "If you hang the phone up, I'm going to call you back." She said, "You don't know my number." I said, "Well, I can find the number in the phone book. It's not going to take me that long. I'm going to leave the phone off the hook." "Well, then I'm going to call 911. "Well, you don't know where I live." "Well, I don't, but the police probably do." So this whole game. And finally, she ended up getting her mom on the phone. And I said to her mom, I said, "I know your daughter from school. I'm one of her teachers. Suicidal. She has pills under her pillow. She has some razor blades as well. And right now, you need to do one of two things. Either bring her to an emergency room or stay with her for the rest until morning, and you can call your physician. But that means stay in the room with her. Do not let her go to the bathroom by herself. Laid out the whole thing for her. Didn't hear from her again for a while. She was not at all happy with me, and that's understandable. I get that. But interestingly, a decade later, 10 years later, I get this phone call. I had moved. I was in a different place. I was in a different school. I was married with kids, like a whole lifetime later. And I get this call one day. My wife says, "There's a woman to talk to you on the phone called Beth." I said, "Hello." And she said, "Hi, this is Beth. Do you remember me?" And I immediately knew who it was. And I said, "Yes." And she asked if we could get together and have coffee. And I met with her, and she just wanted to reconnect. And life was wonderful. I mean, and she went through what had the past decade had been. Sometimes those things happen. Sometimes you get these confrontations, and you need to push through. What's important to understand is confidentiality never exists if you're going to hurt yourself. It just doesn't exist. Or if you're going to hurt somebody else. So you can say to a student, you can share with me and I won't tell anybody, but there's always going to be a boundary to that you need to tell them. And I've had people before upset say they wanted to share something. And I say that, and they sometimes say to me, "There are things I'm not going to tell you because you'd have to share them." And that makes you feel horrible because you know something really bad's going on. I think in a lot of cases it's abusive situations, but they have a right not to tell you, and then you don't have to report, and you can't report. And really, you need to keep the line of communication open, but it's hard. It's hard to hear that and know there are things that they're not going to share with you because you do have a confidentiality issue. But anyone who is suicidal obviously needs immediate help. Now, very quickly, let's talk about 4 reasons for suicide, because this is actually really interesting. So there are 4 reasons that people will kill them. Number 1 is distress signal. And this is the weird one in the sense that there are young people who really need to talk and really have an issue, but they just can't bring themselves to say, "I need help, I'm hurting, I'm depressed." They just can't say it. And it seems like such a simple thing to say. But this goes back to when you find out that the class valedictorian who is in every club and like the most perfect student ever is cutting their wrists, okay? You're seeing it's they don't want to die. We call it a suicide attempt, but really it's not real. They don't want to die. They're doing something that's bringing attention to them because they just can't say the words. They simply can't say, "I need help." And so they do something instead that makes it very clear to people that they need help. Usually they're because they plan on being discovered. They're the ones who might take a bite and call someone. And even though they might say, "Don't tell anybody," they want to be. I mean, obviously, if you want to succeed, you don't tell somebody, so they want to be told. Sometimes they will overdose, a lot of times with medication. Sometimes it backfires. Sometimes the help doesn't come. Sometimes what they take does more damage than they think. One of the drugs that's very common that young people will overdose on is Tylenol. And the reason for that is acetaminophen is sold in the huge tubs. You go to Costco, you get like a family pack of Tylenol, right? Or like 500 tablets. And for most of us, we're never going to use all of that. Plentiful. As opposed to any other drug in the cabinet might have 5 or 6 pills. They've got hundreds of pills potentially. And they take a lot of this stuff. And it usually doesn't kill them. But what it does do, what Tylenol does, it destroys their liver. They have liver toxicity. And they're sick the rest of their lives. If they do the same thing with Advil, it destroys their kidneys and they have kidney failure and they're having hemodialysis the rest of their lives. So just because these are over-the-counter medications, when taken in a large quantity, they can disrupt the health of the rest of their life from this. And this is one reason it's very important to talk to young people about medication and the use and misuse of medication. They have no idea. Or they mix things. They take alcohol and sleeping pills, for example, and they have an additive effect that makes them much more down than they expect it to be. Cardiac arrest, respiratory and cardiac arrest. So the distress signal, they don't want to die, but they want attention, basically. Another one is to manipulate other people. And this is that typical kind of, if you break up with me, I'll kill myself. If you don't do this for me, I'll kill myself. And it's just a manipulate. They don't want to die at all. They simply want you to do something. And so they use suicide as a way of manipulating you. Or if that doesn't work, then a way of punishing. So, okay, you broke up with me. Okay, screw you. I told you the rest of your life, you're going to feel horrible because now I'm going to do this. Very, very, sophomore thinking, obviously. But again, adolescents are very emotional and they're not very logical sometimes. And so those are 3 reasons people commit suicide or try to commit suicide, but all 3 of them have something in common. And that is to die. They want something else. They want life to change in a way that's better for them. And so they don't really want to die. But the number 4 reason, to escape, they want to die. Okay, and they're not going to tell you. They're not going to give warning signs. They actually want to end it. They want the pain to just go away. And these are the ones who are, of course, are at highest risk. When I was in the fire department, we received a call one night to go to a home. Come home. I think she was in her 50s or 60s. In the house with her. They had grown children who had moved out. And when she got home that night, there was a sign on the door that said, "Do not enter house, gas in house." So she called 911. The fire department arrived. We went in, and her husband she was away for the day. He knew she was going to be away. He took a garden hose, put it in the exhaust pipe, put it in the car, turned the car on, crawled in the back seat with a pillow, and went to sleep and passed away. And the house was filled with carbon monoxide. We're airing out the house. We're walking through the house, opening windows. And on the dining room table, he'd laid out for her all the things she needed to deal with his death. All the legal documentation, all their financial information and tax information. He had planned this. And she shared with us the fact that he had been chronically depressed for 35 years. They'd done every drug treatment, every therapy. They used electroconvulsive therapy. They did everything for this guy. And after 35 years, he was done. The quality of life was not worth living, and he wanted to die. And so he waited till nobody was home. He knew he had the house to himself. He had hours to do it. He researched how to do it. He left everything for his wife. And that was his end. And again, it goes back to that, calling this a permanent solution to a temporary problem, not true. Calling it a coward's way out, not true. Suicide is much more complex than that. Thankfully for our adolescents, almost all of them, it is a temporary problem they can get through. And that's the good news for us. But, they may have a parent that kills himself. And I talked to a student this year whose parent had killed himself after he found out he had a devastating, and it's horrible, but it's not as simplistic. And, I always think about that way out thing. This student in my class knows that her father killed himself because he ended up with the disease. And what a horrible thing for me to say in front of a class with that girl in it. That is a coward's way out, to call her father a coward for that. That's why I have to be careful with our words, because I know that we're trying to discourage the thoughts of suicide. But you need to be awfully careful because the audience is much bigger than the simple, "I'm depressed, I want to die." There's more to it than that. Methods of suicide vary. With males, they tend to be more violent. With males, you'll see more hanging and gunshots. With females, you'll see more pill taking. But of course, that's just a generality. Anybody can use any method of suicide to kill themselves. As far as risk factors and warning signs, the exact same as depression, right? So changes in appearance, people who are usually very, very neat and clean, all of a sudden they're not. Quality of work begins to descend. Appetite, either direction. Some people, when they're depressed, eat a lot more and gain weight. Some people stop eating and they lose weight. Same with sleep. Some people, when they're depressed, sleep all the time. They can't stay awake. Other people, insomniacs. Emotional expression, they can become much more emotional than they used to be. If they're creative, they can lean toward really negative and dark things. Excessive use of drugs and alcohol. And of course, what do we mean by excessive? Because with teens, we tell them not to drink at all, but it's excessive from their perspective. From their own peer group would look at them and say they're doing a lot more. Presence of depression, history of trauma, lack of support, running away, having access to lethal means, certain culture or religious beliefs. So again, if someone has a culture or religious belief that homosexuality is wrong, but they're identifying as gay, they're a higher risk because they don't believe there's acceptance or redemption for them. But there are a few of these that are really important for adolescents and like may indicate that something's about to happen. One of them is giving away prized possessions. So when a teenager gives away something like a pet that they care about or personal belongings that have significance to them, it's a concern that thing they cared about is taken care of when they're gone. And so that is an immediate potential sign of an attempt about to take place. Another one is unusual impulsiveness, where they drive really, really fast and taking certain risks they've never taken before because they're almost tempting suicide. And in fact, if you watch that video I recommended, he talks about this very thing of making a driving decision to kill himself ultimately, which obviously didn't work. Ones that I think is really important to be aware of is a sudden and drastic improvement in mood. When all of a sudden they seem great, they seem like they've come out of it, because we all want these people to get better. And all of a sudden they seem like they're just on top of the world and everything's wonderful. And that's fabulous. But what happened is they've decided that they're going to kill themselves. They made the decision. I'm going to do this. I'm going to do this on Friday. And it lifts the weight of the depression off of them because they know now that there's an end game. And so all of a sudden they're relaxed. And a lot of people report that before a suicide has taken place, the person all of a sudden seemed to be better for a few days. So that drastic improvement is a real concern, that people don't get better from suicide that quickly usually. You know, it's usually a more gradual thing. So be suspicious that it drastically. We're starting to run out of time, and I want to try to get through everything. I'm going to summarize this one really quickly. I had a student one time who was involved in a theatrical production I was directing, and he had an issue of substance abuse in the past. Now, the school would tell us, you know, when people drink alcohol and they're underage, we punish them. We punish them by taking out of their activities. And I understand that, because most people going to parties and using, they're doing it for fun, and they're breaking the rules. But when someone is coping with something and they're using alcohol or drugs for that reason, it's not the same thing as doing it for fun and doing it for entertainment purposes. So when I would talk to my students at the beginning of a play, I'd always tell them, you're not allowed to drink alcohol, you're not allowed to use drugs, and if you do, you're going to get kicked out. But I'd also say, if any of you are addicted, or if any of you are using alcohol and drugs as a way of coping with, if you come and tell me that now, you know, before we start our 8-week tour here, if you tell me about it now and you slip despite trying, it'll be a different story. Because it's one thing to go out and just, you know, drink for fun and break the rule, you're going to pay the consequence. But if you're drinking to kind of like keep yourself together, or if you're drinking because you have to drink because you get withdrawal symptoms without, it's a different story, and it needs to be perceived differently. And this is coping mechanisms. You know, when we look at drug use and eating disorders, it's really important to realize that they're not problems, okay? They are coping mechanisms that are causing problems, absolutely, but they're not the primary problem. The primary problem is something else. You know, the anorexic does not have a problem with food, okay? Food is their coping mechanism. There's a different problem going on that is causing them to not to eat. Drug use as well, for the person who's using it because they're upset about something, because they're coping with something in their life. They're not drinking to upset people. They're not drinking because they think it's funny or fun. They're drinking to survive. And what's important about that, you don't take people's coping mechanisms away, because that's why they're not suicidal. They're coping. It's not a good coping. These are negative coping mechanisms. Coping mechanisms, which in of themselves are important. So the benefit is what you have to look at first, and then the problem comes second. And so, for example, with eating disorders, you know, the last thing you want to do with someone who's got an eating disorder is send them to a nutritionist. You know, I mean, they have to go if they're malnourished, obviously, for that problem. But I've seen people with eating disorders sent to dietitians, and they love it, because what they do is they listen to all the things they need to do to gain weight and reverse it and the problem. What they need is they need a therapist to find out why they're acting this way in the first place. And the dietitian is to make sure they get healthy again, but not to let them pick their minds and use it against them ultimately. And it's the same with cutting. You know, cutting is a way of releasing emotional tension and energy that you have no other way to release. There are people who say they can't cry. They can't get themselves to cry, but when they feel the physical pain of cutting, it releases all that energy. If you simply prevent the cutting, where's the energy? How does it get released? And now we're risking suicide. So it's just really important to understand that a coping mechanism should never be punished. We have to see it for what it is and get to the source of the problem, and then deal with the coping mechanism. So, you know, you can't simply say stop drinking. Someone who's drinking to deal with depression. So again, these are self-destructive behaviors, and we need they're seen in the actually are, and to be understanding about those things and not punitive. There's a wonderful movie about suicide called The Bridge. Again, I'm not going to go into any details right now. We only have about 10 minutes left, but highly recommend looking at that. And, you know, it's funny, this show, 13 Reasons Why, when parents ask me how to bring up issues about sexuality, relationships, substance abuse, and all this stuff with kids, I often say, you know, you just don't bring it up in a car because it's just awkward. The best, find movies, find entertainment that show issues, so you can then discuss it with them. You can watch the video together, you can watch it separately, and then talk about person way the situation. How could that have been handled better? It's an invitation into some of these topics. Having said that, Unfortunately, there was a big increase in teen suicides after that show came out, as some people, and we see this with suicide, it can be basically what we call contagious, that every once in a while that people look at suicide and see it almost glamorized in a way. Now, I don't believe the show glamorizes suicide, although having said that, a lot of attention is paid to a girl who's no longer there. So I can understand that. I still think it's a fantastic series for not at risk for depression, brings a lot of issues out, but we do have to be careful what kids are listening to and watching. And certainly music is the same thing. There is music that is written that just dwells on the negative and teen angst. And unfortunately, teenagers don't just listen to music, they derive a lot of meaning from the lyrics of music. And sometimes we have to be careful what they're listening to and to find some music that might be more uplifting and address suicide and address depression in a way that's more open. So now we get to the final part here, in that us as teachers and our students. I'd love to talk about, first of all, why we need to do this in the first place. If you've had children with the terrible twos, it starts at age 1 and it lasts into the 3rd year usually. Fit words to describe them: they're illogical, very opinionated, they're concrete thinkers, and they're not driven to please others. You know, they're not the 5-year-olds who want to help you, clean up after dinner. They just say no to everything, right? They're curious and they can't anticipate consequences. That's the terrible twos. Let's compare that now to the terrible teens, okay? Starts at age 13 and it can last forever in this case. Illogical, opinionated, concrete thinkers that are not driven to please you at all, okay? They're curious without the ability, or more commonly, a desire to anticipate consequences. What we have in common with the two terribles is a developmental time where they're separating from adult authority. For the infant to go into the toddler years, it has to be able to say, I don't want to eat now. I don't want to wear that. No, no, no. It's basically a sense of agency, getting a sense of who they are. I'm not you. I get to make some of my own choices. And without going through that, your toddler is going to be like an infant all the time, and you're simply like a rag doll you're carrying around with you. You want them to go through it despite the fact it's hellish at the time. And it's the same with teenagers. They need to push back against their parents. They need to push back and basically defy some authority decisions on their own, become the person they're going to be. Now, we oftentimes talk about problem solving, and we talk about analyzing a problem, brainstorm solutions, consider consequences, decide and act, and then evaluate on what you did. And what teenagers tend to have the biggest problem with is considering consequences. We oftentimes say of teenagers, we say they're impulsive or we say they're spontaneous. Do you know that's the exact same word? It's just whether you mean something negative or positive by it, right? If you do something suddenly without thinking about something, if my wife and I at our age now are going to go see a movie, it's probably on the calendar 3 months before the movie's even released. It's that kind of lack of spontaneity that I wish I still had that the teenagers have. When teenagers are spontaneous, at 10:30 at night, their friend calls, let's go to a movie. Okay, it's like, wow, what's wrong with you? But we like that. That's kind of, but when they do something that's stupid and we say, what's wrong with you? And that's my favorite thing as a parent to have said, what were you thinking? And they always look at me, nothing, because they weren't. They're not good at anticipating the consequences. Toddlers are bad at the whole thing, okay? But teenagers are not really good at possible solutions, and they're horrible at consequences. They don't have the ability to think through things sometimes. And this is developmental. It's not that they're stupid. It's a developmental thing. And this is what they're working on to get, and it's trial and error as they do. But if you think about suicide, a solution to suicide of your pain. And the problem that we have with them then is to understand that there are other solutions as well. And the consequences of suicide, or the consequences of other things you might do. It could be very simple for someone who is sexted online. Someone gets an image of them and puts it out to the whole school to think, I'm just going to kill myself. There's no ends. And I get that. And it does solve that problem of being embarrassed. But again, you have to look at what other things can we do with this, and what are the long-term consequences of all these different behaviors. And this is where patience of helping them to learn how to process these things is important. I'm going to skip you with some of these things right now to get moving. So what's trusted adult? What do I mean by trusted adult? Well, first of all, when we talk about friendship, a friend is defined as a person who has a strong liking for and trust in another person. And at the same time, we look and we say, we're not our students' friends. We're their teachers, and it's different. And yet being a teacher does not mean you have to like someone or trust them, or vice versa. I think the best way to look at your relationship to a student this way is to say, as a trusted adult, it's a one-way friendship. You know, I'm a friend to them. They're not a friend to me. I don't ask them for favors. I don't tell them my life issues. One directional friendship. It is a friendship, but it's unidirectional. And I think when it stays unidirectional, I think it's a safe friendship. If it becomes, you know, if you're asking your student to bring you home because your car broke down, some boundaries have been crossed at that point. So it's a unidirectional friendship. If a student likes you enough to come and tell you something really private, that's a really important thing. And again, it's a feeling of friendship they have toward you. They will share with us when, first of all, they believe things will be confidential. We're going to talk about that in a moment. When they don't feel judged. And that's huge, is to not judge people. I had a girl one time, the people were spreading terrible rumors about her, about some sexual thing she had done. And she came and told me what was being said and said, people were saying this about me. And I didn't do it. And my response was, it doesn't matter if you did it or not. That's not the issue. What you did, your sexuality is your sexuality. That's irrelevant. People are harassing you is the issue. It doesn't matter what you did and didn't do. You're not being judged here. You know, there's no reason to judge you. It's looking at the situation that is hurtful to you that's important. We need to be able to listen and empathize, build up their self-esteem, and help them to build, because these things are going to happen in the future. You know, that whole idea of you teach someone how to fish, not just give them a fish, because they need the empowerment to be more self-supportive in the future. And so no matter what you're dealing with a young person, you want to deal with helping them become better problem solvers themselves. We need to remain objective and remember there are two sides. We want to believe them, and we can even believe that their perception is their perception, but there are other sides to stories. Sometimes the things they say about their parents or the other teacher or the guidance counselor, that is one side of a story and there is another part of the story. It's also really important to what is mandated reporting. So if you are being physically or sexually abused, if your life is in danger, if you're putting anyone else in those situations, that absolutely must come from us. I cannot hold that. I cannot be confidential with that. That's imperative to say. And they may shut down at that point. And I know now your mind goes crazy saying, oh my God, how bad is this thing that they can't even tell me? We have to tell them that. We have to be honest with that. And sometimes they'll say it anyway, and that's good because now we move the progress on, especially if they're being abused, we situation on as we need to. This is the confidentiality of the Samaritans. So even the Samaritans have a confidentiality that before you call them, you read this, and it tells you there are certain things that we're not going to be able to keep confidential, and we're going to have to be able to get this information out. They simply have to respect that if they're going to listen, have you be there as a listener, you're going to have some guidelines. Guidelines should communicate, like communication, you know, when do we talk? You don't show up at my house knocking on the door. That is not a method of communication we're going to use. Peer collaboration, which is to say, if you share something with me, I might go to a guidance counselor or social worker here in the school and ask them for their background and their information. We're going to have times to discuss this, and it's about the issue. We're not going to just talk about everything during that time. We want to make sure that they understand that we trust institutions like therapists. We trust our guidance counselors. We trust our social worker in the school because we have to pass them along. We're not a definitive source of help for them. We are the intermediary that's going to move them into someone who is really trained to help in a way that's going to be much more streamlined and just expedite benefit. To spend time talking is fine, and I'll be there for you as someone who talks. And you remember, saying that you're going to go to a specialist is not abandoning you. You know, I'll still be here for support. You can come talk to me anytime you want to, but I'm not a therapist. You know, my role can be to be like a friend to you when you need to talk about things, but my role is not to make you better. Someone else has to do that for you. And also saying you see a therapist is not saying there's something wrong with you and that things are out of control. People see therapists for all kinds of things. And I think there's shame today than there's been in the past about seeing a therapist, which is fantastic. When you're talking with them, eye-to-eye contact, put your phone down. I mean, we talk about them and their phones all the time. Nothing should be distracting us from them. Relate with them as you can. Restate the things they say. I always like to tell them the difference between honesty and openness. Honesty is being truthful, and openness is how deep of a story you're going to tell. And you can choose your openness, but I demand honesty. You have to be honest with me. You don't have to tell me everything. You can tell me whatever you want to tell me, but it has to be kept honest, because if you're lying, nothing positive is happening from this. And one of the things we have to love is physical. When a young person, when anybody is upset and crying and feeling out of control, it is absolutely human nature to try to physically calm them, to hug them, to put your arm around their shoulder, to hold their hand, whatever it would be. And this can obviously be either misinterpreted by them or misinterpreted by others who might see it. We have to be extremely careful of this stuff. And I hate to say that because, obviously 99% of people who are going to embrace a student in a time of crisis, it is comforting and it is meant innocently. But again, as we saw from the very beginning, there are people who will turn that around and look for the most negative possibilities on something like this. So I think you have to be careful with it. I've heard people say, always have your classroom door open. Never alone with a student. If you follow those rules, they'll never share anything. No one's going to come out to you as being gay and no one knows it about them with the door open to your room. They're going to have some privacy. Having privacy also means if things around later and say something was said or something happened that didn't happen. And this is where that concern comes in for all of us. We want to be able to be available to students, but not put ourselves at any kind of a liability risk or being accused of something. Just going to skip through here really quickly. Here's the big question. You are talking to someone who seems depressed and you're concerned about them. Ask the questions, have you or are you consider harming yourself? Or are you considering killing yourself? Don't try to interpret them. Don't ask questions that are vague. Ask about hurting yourself and ask about killing yourself. What you will never do, and all the research indicates this, you'll never put it in their head. If someone is that depressed and that upset, you say you're going to kill yourself, they're never going to be like, well, great idea. I never thought of that. That's never happening. Sorry about that. And I will tell you from experience, because I ask these questions all the time. Whenever a student's upset, I always ask these, even if it seems mild. Most of the time, the reaction is no. And I'm so glad that that's the answer. But when you ask the question about killing yourself and the answer is yes, I've never had someone say yes, but they look at you. And it absolutely comes across in the most, I don't know, it's the most amazing thing. It's just, said aloud what they weren't able to say. And we talked before about the fact that one reason for suicide is a distress call. They don't want to die, but they want help. Say it yourself. When you use that word, kill yourself, and they hear you say that, amazing sense of relief that they feel. You didn't make them say it. You didn't make them go there because it is shameful. It is cowardly. It's all those things they think it is. They don't want you to think badly of them. But if you say it, you've taken the pressure off of them. And you just immediately see this sensibility with them that someone now knows. And I'm not hiding it it's not a secret anymore. It's finally out there. And there's tremendous, tremendous relief that you see in them when it happens. And now if the answer is yes, we can't leave them alone. We need to get help immediately for them. But we don't jump up and call. We just talk for a while and you keep the conversation going and then you steer in the direction of where they need to go. Very importantly, if the answer is no, don't ever act relieved, because what they say is that if you act relieved, then 3 weeks later when they are thinking of suicide, they're afraid to tell you. Because when they said, are you thinking of killing yourself? And they, glad about that. Now they think they can't talk to you about that. So you want to make sure that you're objective when I'm glad you're not feeling that way. But if they were to say yes, that's okay. One of the things that I have found really important when someone reveals something to you is a next day check-in. And that is when they've really considered not revealing, especially if you're the first person to know, when they go home that night, all they can think about is, did I make a mistake? Should I not have said this? Because now someone knows. And always found to be imperative is the next day when you see them to make sure you make contact with them, even if it's just walking by in the hall and saying hello the way you always did, but not acting differently toward them, because it reestablished in their mind that everything's okay. I told them the secret, but it's okay. They're still treating me as a normal person and they're not looking at me strangely. And that is a wonderful way to keep in touch with them, to let them have confidence that they didn't make a mistake by sharing, that sharing was the right thing to do, because they shared. The world's still the same, but now someone else knows what's going on with them. A space is usually created to make sure that they are going to be safe. And this is usually by therapists, by counselors, and other people. There is a wonderful app called My3 that can be downloaded on Google or the App Store for iOS, which basically allows them to put in 3 support individuals that they can contact in an emergency. Plus it builds a safety plan, other resources, they can call Samaritans. It's really, it should be on really every kid's phone. It's a fantastic thing. And my resource list will have that for you. And of course, the Samaritans are also a great service as well. They have posters you can hang up in your school to have kids assess you if they need to. And then I know we're 5 minutes out. If you guys want to take off now, if you want to, you're welcome to, but a couple things I wanted to get to real quickly. So I know there's no classes after this. So if you don't mind, I'll keep going. Yeah.
I was going to interrupt you and just say there were a couple questions. I didn't know if you wanted to put it out to the group about staying and answering the questions, or
absolutely
the end. Up to you.
Yeah, let me take 5 minutes to finish this up, and I'll stay for as many questions as people have. Absolutely. Here's the risk for getting involved, because I've been pushing you to get involved because I think we should. I think as teachers, these are human beings. They're not just minds to be taught. And I think we should get involved, but we have to be realistic. Challenging parents' authority and knowing things about their kids that parents don't know will always upset parents. Parents always want to be in the know. But if you are a parent, you also realize that there are things that kids just can't talk to you about. But this is going to be a challenge when a parent wants to know things that you know that they don't. You may present values that they object to. So for the gay kid who comes out and says, my parents are very religious, they think I'm going to hell, for you to say, you're not going to hell, don't worry about that, you have just crossed what the parents' indoctrination is. Do you have a right to? I'd say yes. A lot of people would say no, but I mean, you know, this is why they're coming to you and not coming to their parents about this. And sometimes we can be afraid that parents are going to report us to authorities and say they have a relationship with my child they should not have. It's a math teacher who's talking about being gay to my kid. What's going on? And so these are absolute concerns that we need to be tough enough to take these things sometimes if we get involved with them. Institutionally, there might be rules in your school about how you communicate with students. We have to be careful of those rules. You know, right now we have this whole thing on emotional intelligence, and you know, we have to be worried about how kids feel, not just about what. And yet the rules that were made 15 years ago when everyone was concerned about everyone being abused are still on the books. So we have to somehow find our way through those things. Breaking the chain of command, people saying, why did you talk to the student about this? It's my role. I'm the guidance counselor. I'm the social worker, and people feeling on. Or the appearance of being having favorites. There are certain students they are your favorites. I mean, we all have students we're closer to than others, but if it starts being apparent to other students, that they can often think that you're just being unfair or that you have an inappropriate relationship. And you know, you can't fail to report as a mandatory reporter. You know that if someone might be being abused or abusing someone else, you have to report those things. But there's the issue of like criminal and risk behavior you don't report. How do we deal with that? So 3 quick dilemmas for you to just discourage you completely, ultimately, which I don't want to do, but to make it realistic for you. Okay, ready? Your 15-year-old student shares with you that she needs to get access to birth control without her mother knowing it. Her 16-year-old boyfriend and she have decided to have sex, and they want to be protected so they don't get STDs and they don't cause pregnancy. So what's our problem with this? And normally I'd make this a discussion, but again, with time, let me answer the question for you. In Massachusetts, the age of consent is 16. So if she's 15 and having sex with her boyfriend, she's being raped. It's called statutory rape. So what do? You're a teacher who wants to have decision-making. You can inform her that technically speaking, legally, she's not supposed to, but you know something that is technically against the law. And this puts us, and this is why, you know, the laws have not changed with sexuality as they need to. What has happened is we have these ridiculous laws in the books. Now, physicians, it's interesting, doctors have confidentiality regarding sexual issues with patients from the age of 13. So if a 13-year-old says to their physician they want birth control or STD test or pregnancy test, they can ask a doctor who does not share that with their parents. Having said that, a parent can say, I want to see my child's medical records, and it will be in the medical records. And I have a friend who's a doctor, and I said, how would you deal with that? If a young person had shared a sexual issue with you, and you did not tell the parents because they did not want you to, they're over 13, you don't have, but now they're demanding the record, what would you do? And she said, legally, I would have to give them the record, but before I gave it to them, I'd tell them, if I hand you this record, find another doctor. I'm done. because if I can't have confidentiality with your daughter, that I can't be her physician. And that gives them some weight that we as teachers don't necessarily have. As part of your English class, students keep a journal that's submitted through your school's learning management system, Blackboard, Moodle, whatever you guys use. Ken is having trouble at home with his parents and often writes about this in a journal. During a parent-teacher meeting, Ken's parents demand access to his writings. This is almost like the question of medical records. And parents have access to school records. And I will tell you right now that one of the things I've told all of my students is if you write something personal, do not ever submit it through Blackboard or any learning management system. Because I've asked my school, at the end of the year, do you flush the system? Do you flush everything that was submitted? And they said, no, we keep everything. I've asked for how long? And there's no limit. They can keep it potentially forever, which means that someone can access private information that was submitted to you through LMS anytime potentially. So I would always tell my students, if you want to write something that is personal on paper, because you'll give it to me and share it, and then I will give it back, and your parent wants it, I don't have it. I don't know where it went. And that will cover me. But anytime things happen electronically, it's potentially there forever. And here's my favorite one. 17-year-old seniors, John and Cindy, have been dating for 2 years. They're both your students in separate classes. One day, John is obviously distracted by his cell phone. You approach him, demand he hand it over for the rest of class, bring it to your desk, and as you put it down, a topless picture of Cindy flashes on your screen. What's the problem with this? You've just seen child pornography. Now here's your irony. What's the age of consent in Massachusetts? 16. They can have sex, they can see each other's parts, but if you have a picture of it, you're a child pornographer. Now here's your issue. If you decide to tell on John and Cindy, Cindy is in legal trouble for creating and distributing child pornography, of her no less, but it's still child pornography charge. He has received child pornography, and if he showed it to somebody else, he has disseminated child pornography. And if they go to court on this, they can be sex offenders for the rest of their lives for something that is ludicrous, absolutely ludicrous to call them sex offenders. However, if you choose not to report this, and it happens later in the day again to another teacher who does report it, and then they say, well, the first teacher didn't report it, now you have not reported what is a mandated reporter. I present these to you without a solution. I wish there was a solution, but the idea is that we have really messed up laws, and we need to be very careful in the things that we do and document the things we do and make smart decisions. You know, if I was in this situation, if I saw that picture flash up there and I knew that by reporting him, he could be a sex offender for life, and she could too, I would not want to report that. However, if someone else did, and it was clear that I'd known about that, I have to answer that. And these are the dilemmas that we face when dealing with young people. And I've asked these questions of social workers and other people who work professionally, and some of them, they don't have any answers that we don't have. That's the thing. It's not just a teacher thing. Anyone who hears things from young people as mandated reporters then faces this question of, even though it's called mandated, do I do it? You know, do I open up Pandora's box? And do we have a right to make a decision on that? I don't know, but that's kind of the hard thing about this entire procedure of dealing with young people and trying to be open.